Hi, and happy National Nurse Practitioner Week. Thank you for joining us on this panel discussion. I'm going to be the moderator. My name is Dr. Joanne Keefe. I teach here at Frontier Nursing University, and I am just delighted to be here tonight with such a wonderful panel. We're going to be talking about living the dream as a nurse practitioner. Next slide, please. Thank you. So our four panelists are from different disciplines within the APRN role. Donna Brunson is a psych mental health nurse practitioner. Charlie Davis is a FNP, family nurse practitioner. Dr. Tarika Fuller is both a family nurse practitioner and a women's health nurse practitioner. And Caitlin Rykowski is a psych mental health nurse practitioner. And I'm going to give each of you a chance to introduce yourselves, please. And we'll just go left to right, starting with Donna.
Hello, everyone. I'm Donna. Can you hear me well?
Yes.
So I'm a psychiatric nurse practitioner. I've been in mental health for 16 years. I'm married. I have 3 beautiful children, a beautiful granddaughter. I'm a faculty here at Frontier, and I also I still practice out of the emergency room for psychiatry at this time in my life.
Thank you.
Good afternoon, everyone. My name's Charlie Davis, and I am a family nurse practitioner and, of course, a proud graduate of Frontier Nursing University. And I like to identify that I embody the spirit of Frontier Nursing University and Miss Mary Breckenridge in bringing healthcare and a focus of healthcare to the underserved, underinsured, the non-insured, and the most vulnerable among us. So I'm pleased to have been invited to participate, and I look forward to further discussion.
Thank you, Charlie. Tarika.
Well, hello, everyone. My name is Tarika Fuller, and I am a family nurse practitioner and a women's health nurse practitioner. And I am a proud faculty of Frontier Nursing University, as well as an alumni. I currently work in public health, where I work with the underserved population. I care for patients in a women's health clinic, maternity, child health, epidemiology, STD, anything public health. That is where my drive is and where my joy is. And also I get the honor to meet all of the FNP students when they come to campus as the clinical bound transition coordinator. And I'm excited to be here.
Thank you so much. I just want to mention that Charlie and Tarika are both doctorally prepared. I'm not being disrespectful by not addressing them as doctor. We want to be approachable in here, so everyone is going by first names. And then Caitlin, please, you're next.
So my name is Caitlin Rykowski. I'm a psychiatric mental health nurse practitioner. I graduated from Frontier. I was in the PMHNP class 191, and I was actually the student council rep too for that class. But yeah, I graduated, passed boards. I believe it was January of 22. Started working in a semi-rural, small town Wisconsin. Outpatient behavioral health clinic as part of a larger health system that actually did not have behavioral health in this community prior. So kind of filling the gap there. I do specialize in perinatal mental health, so kind of doing pre-pregnancy, preconception planning, mental health care during pregnancy and postpartum. But I do see, teenagers and adults through the lifespan. So I've been working here since April of 22. So kind of, I think, a year and a half of practice as a psych NP, and am excited to be a part of this panel.
Great. Thank you all for being here. I'm really looking forward to hearing how you live the dream. Could we please go to the first question, the next slide? Great. So How about if we go backwards from the last time that we just talked? So, Caitlin, if you could start, but the question to all of you is going to be, what made you decide to become a nurse practitioner?
So I actually have kind of an untraditional route as far as being a psychiatric nurse practitioner. So I kind of graduated nursing school back in 2017. For undergrad, I had the goal of being a neonatal intensive care unit NICU nurse. And I did. I started working in a level 4 neonatal intensive care unit. Absolutely loved it. Loved the babies, loved the families. Saw a lot of really hard things, though, unfortunately. So, with working in the NICU, obviously, it's not just holding, babies and rocking babies like a lot of people like to think sometimes. And we do see a lot of loss, birth trauma, certainly a lot of postpartum depression and anxiety in families, both moms and dads, for the families that were, having infants in the NICU. So I had kind of got really focused on the families. I recognized there was a need for mental health services for our families. Ended up starting a screening and support program there. Ran a support group there briefly. Kind of did some networking in the community with different other partners who really specialize in, advocating for maternal mental health services. And after a while, I kind of grew frustrated, actually, because we saw that I would screen our moms and dads and see that there was a huge gap, families needing to get in for services for psychiatry, for therapy, and the wait lists were incredibly long. So for a lot of patients or, parents, for families there, we saw it was taking, a handful of months when we had parents who were, mothers, fathers of preterm babies born 23 weeks. We didn't know if they were going to survive in some situations. And so a lot of stress, and we know that that's a risk factor. So I saw that gap in care. Some of the partners that I made through networking in the community had kind of suggested, like, you should go back to school. And I'm like, I could never be a nurse practitioner. Never was never something that I thought that I would be comfortable doing. I kind of had the anxiety, fear about it, I took the leap. I, applied to Frontier and kind of never looked back. It's been quite a journey, but that was kind of my goal, was to really be able to fill that gap in care and provide a much needed service to families.
Thank you, Caitlin. Torika, let's just go back up the screen.
Excellent. So what happened to me was I actually became a nurse in 2002, and I did a lot of areas within nursing, and ended up actually in GI, which I love. My husband and I moved to the Ohio area, and I actually landed the best job ever. My last job as a nurse was being a GI aerodigestive nurse for Cincinnati Children's Hospital, which I loved. And at that time, I was in a leadership position, and I decided to go back to school. I knew I wanted to go to graduate school, as I've been a nurse for years, and I was like, oh, it's time for me to advance a little bit in my role. So I decided to go back for a master's in nursing administration, because I was concerned about not being able to get the clinical hours in. And so I talked with my supervisor, and I was able to do the 70 hours. So I was like, oh yes, I can do the 70 hours of clinical hours for my nursing administration. As soon as I graduated across the stage, at the graduation, I was approached by one of the faculty who said, you only have 8 classes to become a nurse practitioner. And I said, oh my goodness, I would love to, but the clinical hours. And I was really thinking about it, because I had spent that time back working with patients again. And I was doing the anesthesia call, I was in the OR with the patients, spending time with the families. And I knew that I really wasn't ready to go into leadership, because at that organization, it's either leadership or nursing. It wasn't really a job where you can do both. So I knew that it was going to be a time before I actually left my patients because I loved it so much. So I went back to talk to my supervisor and I said, what do you think about this? And so she said, you can do it. We will make it happen. So I ventured out and enrolled in those 8 classes at Indiana Wesleyan University and was able to get those 700 clinical hours in. And I'm glad that I did, because I knew that there was many times I was talking to patients on the phone, and when you have to pass that information on to your physician or your nurse practitioner, and you feel so bad because you know what's going to happen or what needs to happen, but that's not in your scope, right? So I needed to gain that scope in order for me to provide a full care for my patients as a nurse, and now as the advanced practice nurse. So that's kind of my road to becoming a nurse practitioner.
Thank you. I'm hearing some similar themes already. Donna, how about you?
Hello. So the road to being a nurse practitioner, of course, began with I started out in postpartum, and then I was floated one day over to the psychiatric unit, and I just fell in love with those patients. They reminded me so much of family members that I had just suffered so much with mental illness, and at times it was so difficult for them to get treatment. And this was a while back, but so from there, I actually became a manager of a couple of psychiatric hospitals. And I was a manager, but I felt like I was just moving away from the patients instead of forward. And there were things that I could not do. I felt that, like, oh, I would do that treatment plan differently. I would do this. I would do this. This is my treatment. I wanted to own that treatment plan, be such a huge part of it. So that was my road to become a nurse practitioner. So I was a manager at the time of a 140 bed psychiatric unit that had med psych, and also had a psychiatric emergency room. And so I went to Midwestern State University in Texas. I worked full time. I don't even know how. I don't remember ever sleeping, ever at all. I don't think I ever slept. I remember going to a wedding, and one of the friends who was also a psych NP, and I was like, I wonder what happened at the wedding. And she goes, you were there. And I go, I was. But anyway, so my role there became to be nurse practitioner. I really love to help people. And I feel like those with mental illness, it's so difficult to navigate that road and to have someone advocate for them. There are many things. I have many times felt that joy of being able to talk to a parent whose child is diagnosed with bipolar disorder, who has depression, many ways that can be there through all the struggles in their lives. And I love that. And so I really wanted to own the plan. I wanted to become such a huge part of it. It's like you have to have that certain scope that you can be there, that you can have that scope to practice the way you want to. And so that was my role to become a nurse practitioner. I love it. I especially love psychiatry. I love it with a passion that I don't know if I can describe. I love it like I love my children.
Wow. Thank you for that. That's wonderful. And then, Charlie, how about you?
Yeah, like my co-panelist, I began as a registered nurse. What I saw in my practice as a registered nurse was, in many times, I felt I could do a better job in caring and delivering care to the patient than the individual who I was taking and carrying out orders for. So in my particular case, I'm driven to nurse practitioner work by several key elements. And first and foremost is the autonomy that nurse practitioners have. Now, obviously, that varies from state to state, and I happen to live in New York State, so the autonomy is quite large. So autonomy was very critical for me in making that decision of going from nurse to nurse practitioner. And most importantly, it allows me, based on what I saw as an RN, it allows me to build what I believe is purposeful and meaningful patient-provider professional relationships. and use the training that I received and the education, of course, and the subsequent clinical judgment that Frontier provided me to best meet the healthcare needs of the patient. So again, autonomy is first and foremost, and then carrying that out to each of my individual patients. But I'd like to highlight as well, as an undergraduate in one of my courses, I was exposed to Frontier Nursing University and Miss Mary Breckenridge. So I heard the call very early on, and they said, if I'm going to go to graduate school, Frontier is where I'm going to go. And that's where things began for me.
Thank you. Well said. You just gave me a little chill there. That's wonderful. So some of the common things I'm hearing, and I just noted, is that you wanted to do leadership with nursing, leadership in nursing, not, and not get away from patient care. Um, you wanted the ability to have the scope of practice, or the autonomy, as Charlie said, to do the things the way you wanted, or the way that you thought was right and best for the patient. And then the last thing I heard is that you all saw a healthcare need, a disparity, and wanted to attend to that. You answered the call, as Charlie said, like you were called to this, and seeing the lack of care that was out there, which is a wonderful thing. Thank you so much. Okay, can we please have the next slide? So what motivates you to continue living your professional dream? And Donna, let's start with you.
My professional dream has always been to help the mentally ill. What motivates me continually is my own family's, as well as my patients' struggle to live a life of optimal living, whatever that might be, to give them the highest amount of joy, the most sense of wanting to get up in the morning and do something and just live a life. I've had several family members who have a mental illness that's pretty serious, and I love that I'm able to motivate them. They motivate me, and I motivate them. My professional dream is to continue to serve others. I've worked in, like I said, shelters, women's shelters, men's shelters, emergency rooms, inpatient, outpatient. I've worked with adolescents. And when you help that adolescent who just stopped wanting to live, to actually want to live, and they pursue their dream of being an actor, of being an astronaut, of just wanting to live, there's nothing that will bring you more joy than that. I love my professional dream. I love what I'm doing. And every day that I can help someone, it just reinforces that dream.
Wow, well said. Thank you very much. Tarika, can you go next, please?
Yes. So I am truly living the dream. I will say I have been working in public health for a majority of my nurse practitioner career. And when I interviewed for this position, the collaborative physician that was there, she asked me to follow my heart. She said, follow your heart, and it will help you to make a decision on your career, on whether you want to work here or not. So I did have to go home and give it some thought. And I knew that my heart was with the underserved population, and having the opportunity to work alongside with my patients who are uninsured, underinsured, having difficulty with seeking out medical care, and having the opportunity to be there with them every single day of the week when I'm there, and having that opportunity to let them know that they are not alone in whatever situation they're in. And I tell patients all the time, I don't talk money. They're like, how much does this cost? And I say, I don't talk money. I talk healthcare. And so I never want a patient to feel like they are not eligible for service for the cost. So we don't talk money. I say, this is what you need. This is the service that you need, and we'll go from there. So I am truly living my dream because I get the opportunity to bring healthcare to patients who would otherwise would not have a resource. I am that access to care to my patients. Each time that I see one patient, I am providing them care could possibly be nowhere to be found. I am grateful for the public health in North Carolina and all over the states that we are able to provide these services to our patients. We are curing diseases for patients that could end up with cancer. We're bringing services to them, vaccines to them, healthcare to them, medications to them that could possibly save their lives and save their families' lives that oftentimes the patients are not able to afford. But we have ways of doing that. And I love that every single day. It is truly, truly a calling. And I heard someone say before, find something that you enjoy doing and it won't feel like a job. So I don't have a job. I get to go to work and do what I love.
Wow, that's inspiring. Thank you. Charlie, can you please answer next?
Sure. And I'm motivated by just hearing the previous speakers talk. I find when I'm looking, I'm nodding my head up and down. So everyone has a great story so far. As I'd identified earlier, in my particular case, I was inspired by Miss Mary Breckenridge's history and her work. I'm still inspired by that, as well as what I'll call the Frontier University esprit de corps, the values, the camaraderie that actually exist. And I'm sure, well, let me speak for myself, but I'm confident probably the panelists have seen this, that when you work along a non-frontier prepared nurse practitioner, we're a unique bunch. We're extremely well qualified, whether that's a clinical diagnosis or simply how we use the instruments that help us make our diagnosis. There is something definitely unique about the Frontier Nursing University. So that's what I call the esprit de corps in part. But those two elements, Miss Breckenridge and Frontier Nursing, the esprit de corps, it ignited a fire for me, and I still have that fire. And again, in the treatment of the whole patient holistically, we just don't treat the patient as he or she comes in for a particular disease or issue that day. We take a look at the whole picture to understand what is the issue with the patient, and not only how we can help them today, but what can we do, for instance, from an educational standpoint, to help them to be better and healthier into the future as well. And again, I come back to the uninsured, the underinsured, the underserved, and the most vulnerable among us. And I carried that out initially after graduating from Frontier by opening up a fully functional school clinic, uh, rounding up support, funding, political recognition in order to get it off the ground and running. So again, I'm indebted to Frontier and the motivation that it provided me.
Thank you for sharing that. And last but not least, Caitlin.
So before I answer the question, one thing I wanted to chime in with is before I was kind of nodding my head, Charlie had mentioned something about Frontier, being Frontier prepared, nurse practitioners being kind of a step above the rest. One thing that I would add to that is actually, so when I first started working for the health system, my collaborating physician had actually commented on that and was like, you as a nurse practitioner, like, I don't know if it's your school or what, but you are, you have a lot more knowledge and skill and training than any of the other nurse practitioners that we've seen before or worked with. And so that was certainly something really nice to hear. But, I feel that too, that it was, even though, I think back to, day one, a year and a half ago, of all the emotions that come with, like, oh my goodness, this is happening. I'm a nurse practitioner. But also, that is really, really rewarding, and, to know that we were prepared so well and to hear that. So, in regards to the question, I think it also kind of brings up a good point too, as well as rural healthcare, right? So with rural healthcare, we know a lot of times providers don't want to um, kind of live in those communities. Not the most attractive in terms of small town life for a lot of people. Something I actually, and it sounds like many of us, all of us, greatly enjoy, is kind of filling the gap in the underserved community. What really motivates me is my patients. When I, first started, I would say a pretty significant amount of my patients I still see, that I've seen since day one. Um, and really the relationships that we form, obviously therapeutically throughout that time. I kind of think about, when I first started seeing many of my patients, they were at their lowest, either struggling with, depression, anxiety, many, with suicide attempts, whether that was, thoughts of wanting to end their life, or even after a suicide attempt. Seeing them at that, critical low, and then also being a part of that progress, right? Like, part of it is certainly medication, but it's more than that. It's the relationship that they form with us as providers, and being that motivation to continue on, and, to have that hope. So also, I just absolutely love watching the progress along the way, from that super dark place to kind of rising above. One thing that stands out to me is recently I had attended a suicide walk as a part, as a provider for our booth. And one of my patients had actually attended the walk as well, who had unfortunately attempted suicide and is a survivor. And so it was really, I'm not going to lie, kind of teared up myself at the walk, just seeing her. But to go from overdose in an ICU to raising hundreds of dollars for suicide prevention, and being, instrumental in her progress along the way, was really eye-opening and, rewarding in all senses of the word. And so really that's kind of my motivation, is to see my patients struggle, to go from that dark struggle to living a life that they desire. The other piece of it that I think is really motivating is also creating change in healthcare. So when I started working at this location, like I said, we didn't have much in terms of behavioral health services. It was a new practice, hadn't had any in the community for quite some time. Through this clinic, so I am the only provider here that's able to prescribe medication myself, and then we have a therapist. So kind of being the person to go to, but it's been really, really cool because we've been able to form some relationships with different specialties too. So working with primary care on de-prescribing controlled substances. Unfortunately, we know that, with the opioid epidemic, benzos as well, a lot of times there are a lot of controlled substances which were being misused or abused. And so using those, kind of that as a teaching point of, they can be really, really effective when needed, but also not for long-term use. That's been, one thing that we've been working on. The other thing is working with the ER on what to do with suicidal, patients that come in crisis, and kind of improving the experience that they have in the ERs, because it can be, again, at that super dark place, what is that like to really ask for help? And sometimes that help is, not necessarily voluntary. The other thing too is we're actually working on creating which we just got funds for through grants, a women's mental health support group, as we noticed that between myself and our OB department, we noticed a lot of women with similar experiences and not much in terms of having that, that peer support. So we're working on starting a support group to help kind of improve mental health through kind of a larger scale, and build those relationships. So those are certainly what motivates me to kind of continue on, and certainly a dream to be a part of.
Wow, you all are so inspirational. I just want to talk about a few points that I heard from you, and that is number one was that patience, or what motivated you the most. Then the fact that it's meaningful work, really truly feeding your soul kind of work. You get to walk with people who need help, and then you get to see progress from taking that walk with them. Um, and that you're well qualified, and that you get a lot of motivation from knowing that you come from a good solid place is something that helps you keep motivated, and that you bring education and systems change to the work, and that helps you to stay motivated as well. All really inspirational stories. Thank you. Next slide, please. So can you share what you have learned from being an advanced practice nurse? And Tarika, please, if we could start with you.
Yes, please. What I have learned as an advanced practice nurse is the importance of the role of the advanced practice nurse and how this role has allowed us to definitely bridge the gap in healthcare and to service our communities. And it continues to grow every single day. I'm so surprised every day of the different things that we are able to do as advanced practice providers for our community, whether it is for our patients at the bedside. We also have multiple roles in our government. We have roles in leadership. We're in the C-suites of our hospitals. So it is very much impressive just to see all of the work that comes from the advanced practice role and all of the knowledge that I hear everyone here on this panel, which I'm very excited and impressed to be upon, from whatever education university that you were a part of. Of course, we all have seen the work and are evidence of the work that comes from Frontier Nursing University. So I am just amazed at just hearing some from the panel. It's myself. And I know that as advanced practice nurse, that for me, what I have learned, that there's no stopping us. Um, there is no stopping us. That the sky is the limit. I have seen where, even for myself, I've been able to change the title of the advanced practice nurse for public health for the state of North Carolina. I've been able to bring patient care medication treatments to my patients that did not exist, using my doctoral degree to actually change practice. So there's so many things as an advanced practice nurse that we can add to our patients and to continue to change and to bring those things forefront as an advanced practice nurse. There's so much room for us. This is all that I've learned as an advanced practice nurse.
Wow, amazing stuff. Thank you. Caitlin, you're next, please.
I 100% agree with Tarika. I think that it's a big, opportunity for us as nurse practitioners to be able to kind of go above and beyond and do more. One thing that stands out to me, I think, is that we do see it, patients from a more holistic view, where a lot of times, patients aren't a diagnosis. Kind of looking into and exploring, what's going on at home, right? Like that can certainly impact mental health, physical health, all sorts of aspects in their life. And so patients really, really do appreciate the time that we take as advanced practice nurses. I know many things that I often hear from my patients is thank you. I finally feel heard. Because a lot of times, healthcare can be seen as, kind of get in and get out. And they've had, pretty negative experiences with healthcare. And so having, changing that for patients to be able to really be able to feel comfortable enough to share, like I always say, being a psychiatric nurse practitioner is I kind of know people's deepest, darkest secrets, right? Like we talk about all sorts of things. And so having that comfort level where they feel like they can open up, even when we talk about kind of going forward with different patients who struggle with, for example, addiction, you never know when it's going to be the time that they change. And so kind of using the motivational interviewing skills that we learned way back when in the program really does come into play. And I've certainly used that with many of my patients. The other thing that stands out that I guess, something I've learned about being an advanced practice nurse that maybe I didn't quite expect as much is prior authorizations. We have so many prior authorizations that we're having to do on medications to get the right medication for the patient. So yes, we know that the patient would benefit from the medication. We know that it would be a good fit for them. They've already failed a lot of other medications, but insurance doesn't cover it because it's expensive. And so being able to advocate for that patient, these are the reasons why this patient would benefit from the medication. We do a lot of prior authorizations.
Good point, Caitlin. Thank you. And Donna?
Well, I have to agree with the panelists. I have learned many similar things. I have learned that we are well respected. Patients will say, "I love you. You're my nurse practitioner. I love it." They will say, "I felt so heard. I feel so heard, and I respect you. And I can't wait to come back to see you. I feel like you're listening." And that's one of the biggest things that I have learned is that the patients respect that we are nurses, and they respect that we're at that higher level that we can assist with their treatment plan and hear what they're saying. And I've also learned that being a faculty at Frontier, I've learned that I love being a mentor to the students coming on. I love seeing that next generation that's going forward, and I love that. So what I've learned is I've loved the trust the students and the patients provide me as an advanced practice nurse.
Wow, that's beautiful. I think if I could sum everything up that you all said, it would be pride in being a nurse practitioner. You've learned the role. You've learned that APRNs create effective change, bring excellent care, especially around listening and truly caring about a patient. And then there's advocacy and lots of hoops in doing this job, but being a patient advocate helps you to get through that. Okay, next slide, please.
So what I've learned from being an advanced practice nurse, the list is long and it continues to grow. I think I learn every day, whether it's something new clinically or it's something new about my patients, how to interact with my patients. Again, the list just grows and grows, and I embrace that. I don't avoid that. I don't run from that. I definitely embrace that. But one thing in particular that I've learned since being a nurse practitioner is that despite, and this is for me just so surprising, of the industrialized nations across the globe, the US is the last in patient outcomes. And this is despite the fact that we spend more on healthcare than any other nation. And to me, that is just shocking when I learned that. And as a nurse practitioner, what I can do about that. So fundamentally, it's the affordable, accessible, high quality, evidence-based healthcare that people need. But again, despite the fact that we spend more money, we being the US, we're still so low in the desired patient outcomes. So there is just enormous opportunity, I believe, for the US healthcare system to get its foundation rebuilt, and that the current RVU and the 15-minute model, we need to do something about that. And nurse practitioners who operate from a nursing model of care, we're so well positioned to do something about that. And now I'm going to roll back to Miss Mary Breckenridge and Frontiers Esprit de Corps. We were trained to do something about that. So again, I believe that is just fundamental that in the U.S., as a starting point, affordable, accessible, high quality, evidence-based healthcare is a must. So again, that's one of the key things I've learned, and that is simmering with me every day. Thank you.
Wow, that's beautiful. I think if I could sum everything up that you all said, it would be pride in being a nurse practitioner. You've learned the role. You've learned that APRNs create effective change, bring excellent care, especially around listening and truly caring about a patient. And then there's advocacy and lots of hoops in doing this job, but being a patient advocate helps you to get through that. Okay, next slide, please. Oh, thank you. All excellent points. Thank you all so much. Let's go to the last question. And Charlie, I'm going to say, please roll on as the first one. And so the question is, what advice would you give to yourself as a beginning NP?
Yeah, as a beginning nurse practitioner, uh, we're always, we often are wondering whether we're making the right decision. I'm confident, and I look now that based on Frontier Nursing University's training, we know what the right thing is to do. So if you know what the right thing is to do the right thing for yourself and for the patients. We're trained, we're competent, and we have the skills and the knowledge. So don't be hesitant. You have that ability. Again, you know what the right thing to do is. You know what the right thing to do for your patient is. Therefore, simply do it. And if necessary, professionally and politely, because we don't operate in a vacuum, professionally and politely push back when necessary, and hold your ground, make sure your message is heard, and don't make it an emotional decision. Make it something that we were all trained to do. Let our decisions be evidence-based. So thank you for letting me address that.
Thank you, Charlie. Next, Donna.
Be bold. Come out as a strong advocate out of the gate for your patients. Be everything you told yourself that you would do, what the reason why you wanted to be a nurse practitioner, to have your patients back. So I would tell myself, looking back, be bold, be bolder, like Charlie says, be bold, be a strong advocate for your patients.
Wow, you guys are rocking this. Very excellent. Caitlin.
So I actually just had this question from a student I'm precepting recently of, what if I don't know everything? Like, what if I don't know what to do? What if I don't know the answers? Patients will sometimes have questions, and I'm not going to lie, like Charlie had mentioned earlier, we're still learning. We learn something new every day, whether it's clinically, whether it's, something within practice, patient's life, anything. Um, it's okay to not know all the answers. So in the beginning, I know I at times would consult I'm in Wisconsin. We have a reduced practice. We're a reduced practice state. So we do have to have a collaborating physician. I would reach out to him if I had any questions or concerns with the patient, like, hey, what do you think about XYZ? I think we're oftentimes, as a provider, you feel that pressure of like, I need to know what I want to prescribe. The patients here today, they want something. And I think it's okay to understand that that patient wants to be heard and they want time. They want to have that relationship with you. So if you don't know what the next steps are for treatment, that's okay. You can look it up. Obviously we have plenty of resources to utilize, whether that's through apps or online or books, etc. Each other also great resource. But it's okay to not know the answer and to tell the patient, that's a great question. I'm going to look it up. Let me do some digging and find out what would be the best plan for you. And a lot of times patients really do enjoy that because they feel like they're being heard, and you're not just going to, throw medication at them and say, here you go, have a good day. They like to know that you're doing something that really will better their health, better their wellness. So that is definitely my advice is take your time. If you know what you want to do, fantastic, go for it. And if you don't, you need a little bit, that's okay. I know when I first started, I definitely would say, you know what, I'm going to do some digging on that, and I'm going to give you a call tomorrow and we'll go through that. Or I'll bring you back into the office next week and we can finish our assessment. Totally okay.
Wow, wise and experienced words for sure from all of you. Tarika?
All right. So for myself, what I will tell myself, and I have the honor to also be the clinical bound transition coordinator for the F&P program. So I get to also speak to others at the beginning of their clinicals. So my big go-to is to always remember your why. To remember why on your good days, to remember why on your bad days. Why did you want to become a nurse practitioner? And that will always continue to keep a smile on your face and to keep you focused on your goals and on your patients and on yourself, and to pursue what your desires are. Also, I'm big on being a change agent. If you see a problem, be that change agent. Be that person that points it out and said, why do we have to do it this way? Especially if there's new evidence-based practice, not because we've always done it this way, but is it the best for our patients? Is it bringing the best outcomes for our patients? Be that one to bring it out. And also never stop learning. Be a student for the rest of your life in regards to patient care, because there's always, always something to learn. And no, even years and years down the road, we do not know it all. Medicine constantly changes, patient care constantly changes. None of us have ever seen COVID before, but we learned a lot from it. So take any opportunity and be a student in it. And that's what I would continue to tell myself, which I often have to do that all the time.
Thank you. Thank you. Sage advice. Okay, the next slide, please. And so I just want to give everyone an opportunity to say parting words, anything that's come up that we haven't talked about or asked about that you want to impart to people who are viewing, any advice for people who are considering this profession, anything at all. So open field, and let's start with Caitlin.
It was really fun to be a part of this panel. I'll start with that. I think that it's, certainly a blessing and a calling to be a nurse practitioner. And so to be able to share, our passions with both each other and anyone, viewing this session, I think that it's, super, super great. In terms of other things that come to mind, I think we can't, one thing that I like to highlight too is the importance of networking. When we're thinking about both when it comes to, employment opportunities, but also, reaching different, starting being the change agent, as Tarika had mentioned, being able to start different programs, being able to, expand services into specific areas, being able to have that connections to different people, different organizations, is super, super helpful, because we know that when you have connections to other organizations or providers or different agencies, you can really meet your dreams. You can expand in different directions. For me, I was able to kind of work towards the perinatal specialty through different networking. Obviously, that was kind of what fueled me to go even into this field, was some of the people that I met through networking. The other thing that I would say is with being a nurse practitioner, we certainly have the opportunity to kind of change, in where we go. There's so many different things that we can do. And the fun thing that I see in practice is, I'll see patients come in, and then I'll start to see their friends and their family members. And, sooner or later, your name's kind of out in the community, and others are, kind of saying, I had really great care here. You totally need to go see them, which is really fun for us, as a provider, to be able to have that feedback where you're able to reach even more patients because of the care that you give to just one. And so those would be my parting words, is to enjoy every minute. Some days are a little harder than others. And I believe Tarika had kind of said, remember your why.
Thank you. Tarika, do you have any parting words?
Oh my goodness. You and all would not believe. You would think that this was planned, which we do know that we were all invited. But this last slide, success doesn't come to you, you go to it. The young lady in this photograph, her name is Dr. Sharice Dyer. I met her at the gym. And I said to her, I learned that she was a nurse practitioner. And we went to the exact same gym. I saw her in the locker room. And I said, I learned that I asked her where she works, and she said that she works at a health department. And I said, do you enjoy your job? And she said, yes, I do. She said, we actually have openings. And she's the reason why I'm at the job I am today. It's just meeting her at the gym. So as Caitlin said, networking. It was a complete conversation in a gym in regards to opportunities at a public health department. And she's no longer there with me, but she is the driving force that got me to the health department. She's also a graduate of FNU, so she talked about her school all the time. She's has multiple degrees from FNU, and so I knew that when I want to go back from my WHMP, that's exactly where I wanted to go. So as you see, networking, making friends, making connections, and you go to it. Me asking her that question, I am actually living my dream. So if nothing else, take the opportunity, take the leap, and seek your dreams, and in order to live your dreams.
Thank you. Isn't that funny that that picture's on there? It's a small world.
Yeah.
How
Very.
about very small? Donna, how about you? Any final words?
I would say to anyone contemplating becoming a nurse practitioner, be bold, take that leap. We need you. There's a future patient out there waiting just for you. And I feel as though I have done two things to inspire. My daughter-in-law is becoming an FNP, and her sister is becoming an FNP. And I am just so proud of them. And they are first generation migrant children.
Wow. Thank you. And Charlie?
Yes, I'd like to just end with Joanne. Thank you to be an excellent MC for our panel discussion tonight. I'd also like to thank Lisa Chappell as well. I know she had some early work and involvement in this, so I'm grateful to both of you. And of course, I'm grateful for FNU. Frontier continues to be a marvelous place for anyone contemplating an advanced nurse practitioner role. FNU is a place. Read about it, understand its history, understand what its motivation is, and it will call you. And when it calls you, you will continue to follow the message. So I'm grateful to be part of such an esteemed panel, and I hope everyone has a good day.
Thank you. And in the spirit of gratitude, I want to thank you all for inspiring me. And I learned a lot tonight. One of the things I learned is that we are cut from the same cloth. I think we're called in the same way, and that we do really, really good work as APRNs. And I'm so proud to be a part of this community. And I want to thank you all for sharing your stories and your experiences and your advice and your wisdom. And this has just been a delight for me. So thank you. And I hope everyone has a great night.